Good evening, everyone, and thank you for joining us today. We are excited to have you all here for another wonderful patient webinar. See clearly, heal comfortably, the key to better cataract surgery. My name is Gabriel Macias, Business Development Manager for Harvard Eye Associates. It is my pleasure to introduce our presenter for this evening, Dr. Behnaz Rouhani, Cataract, Cornea, and Refractive Surgery Specialist. Dr. Rouhani is a board-certified ophthalmologist who specializes in cornea, cataract, and refractive surgery. Dr. Rouhani specializes in the medical and surgical treatment of corneal disorders, such as ocular surface disease, corneal dystrophies, and laser vision correction. She is a skilled surgeon with a compassionate, patient-focused approach. Dr. Rouhani is also a board certified in internal medicine. This unique combination enables her to have a better understanding of the overall health of her patients and how different systematic diseases can affect eye health. Dr. Rouhani, thank you so much for being here to host tonight's patient webinar.
Thank you, Gabrielle. Good evening, everyone. Thanks for joining us tonight. I'm very happy and pleased to be here today. We're going to go ahead and talk about what happens before cataract surgery, what we check, why we check, and how we can make this process comfortable and clear for you so you know what you're going to be expecting prior to proceeding with cataract surgery. My goal tonight is to walk you through the process and make it very clear so you know what to expect once you're being evaluated for cataract surgery. So preparation for cataract surgery is very important. Not only we check your cataracts and see what the cataract level is and whether you will need to have cataract surgery or not. It's a lot more involved in this process. There are pre-surgery steps where we want to make sure that you understand what's involved in preparing for cataract surgery. Is how we evaluate you. It's not just your cataracts, but the whole health of the eye, including your retina health, your optic nerve health, your cornea health, and overall the ocular surface health as well. And why evaluating your ocular surface health is very important before surgery. Dry eye role is very, very crucial. Understanding how tear health impacts surgical outcome is very, very important, and how overall we can maximize your visual outcome after cataract surgery. So I'm just going to review what overall ocular surface disease is. Ocular surface disease affects the tear film and the overall front part of your eye. It includes several related conditions, including the glands that they are in charge of producing the tear film for you, and also the tear film stability itself. So common ocular surface disease conditions are, apart from dry eye syndrome, blepharitis, which is inflammation of the eyelids. Meibomian gland dysfunction is when the oily glands that are located in your eyelids are not functioning well to provide you enough oily part of a tear film. And allergic conjunctivitis, where inflammation affects the whole surface of the eye and therefore your vision. Symptoms to watch for, and you probably have been noticing a lot of, patient population in Southern California actually have those due to a wide variety of reasons and multifactorial reasons, such as exposure to environmental factors, medications, internal, conditions, such as different diseases that we might have, different medications that we might, take. Would include persistent redness or irritation of the eye, excessive watering, tearing, burning sensation, foreign body sensation, sometimes even pain, and also fluctuation of the vision throughout the day. Sometimes these symptoms can overlap. So some patients feel like, okay, the blurry vision is only due to cataracts, not knowing that actually the tear film stability and ocular surface health is going to affect how the quality of your vision is. Cataracts is technically cloudiness of your natural lens inside your eye. It will cause, difference and deterioration in your vision quality, but that is going to cause, that's going to be like as a constant change in your vision, not necessarily fluctuation of the vision. You can have glare and halos around the lights or starburst effect. You could be having trouble with bright light, but these are also overlapping symptoms that you can actually be experiencing them with dry eye disease as well. You also, with cataracts, could start noticing that nighttime driving is going to become very difficult due to starburst effect and glare. Ocular surface disease, however, as we kind of like reviewed, can cause intermittent blurriness, fluctuation of your vision and vision quality. Sometimes you could be seeing better than the other times. Using some artificial tears can give you temporary relief or improvement in your vision, which cataract does not do that. Once cataracts are formed and they affect your vision, that's going to be a constant change in your vision, not fluctuation. Light sensitivity can happen as it can with cataracts. And um, I spoke to you about vision that varies with blinking and sometimes with using drops. But that's again an intermittent thing, not really constant. So once we are actually experiencing those intermittent visual changes, light sensitivity, and overall irritation and discomfort of the eyes, we have to technically take care of those before we proceed with cataract surgery. And the reason is how this can affect your visual outcome after cataract surgery, which I'm going to get into it in details in a minute. So both conditions can cause blurriness, uncomfortable vision, and overall, you're going to notice deterioration in your vision, but comprehensive evaluation and proper testings are really critical before proceeding with cataract surgery to make sure we're not going to miss any other conditions that are existing in your eyes. How common is ocular surface disease? Believe it or not, it's very common. 50% of the patients actually have dry eye disease in addition to cataract. So patients who come here and they have trouble with their vision and they feel like vision is deteriorated. Most of them, they have a combination of cataract and other ocular surface disease. And a lot of studies have shown that 75% could be affected. So while cataracts are very easily diagnosed on your routine examinations, ocular surface disease are frequently underdiagnosed. So we have to really make sure that special testings are done, special evaluation, detailed evaluation is done prior to proceeding with cataract surgery. The hidden challenge is that this could be very silent. That means that sometimes patients have like deterioration in their vision, but they don't have any other symptoms. No redness, no irritation, no burning sensation, no foreign body sensation, or not feeling dry at all. But on exam is very important to be evaluated very in detail to make sure that clinically they're not having any symptoms of those conditions because those are prone to get worse once surgery is done. There is a very important, reason behind this much of stress that I put on how important it is to evaluate you prior to cataract surgery because surface of the eye is very, very important in refracting light through the eye to make an image of the objects that we're seeing. So if the surface is not nice and clear, it's not healthy, all the measurements that you're going to go through prior to cataract surgery could be affected. And this can lead to less than ideal measurements that we get for the lens implant that we're going to replace your cataracts with. And therefore, your visual outcome might not be as ideal as we would want. And post-surgical complications, we do see, and you might have heard from a lot of your friends, families, members, or neighbors that they might be having a lot of issues after cataract surgery with their eyes. And that actually is a sign of untreated ocular surface disease that was pre-existing and it was not noticed prior to cataract surgery. So it's really important to evaluate that prior to surgery, start the treatment process, and continue the treatment and management following surgery. Again, why is it important to treat ocular surface disease before cataract surgery? Here I'm actually showing you the picture of what the tear film is consist of. So tear film is not only water, it does have a lipid layer that helps to stabilize the tear film on the surface rather than due to gravity having tearing, So, and then there is a watery part of it, which is the middle one, and then there is a mucus layer as well. And these are kind of like created in a way so the eye tear film is not going to be unstable and it's not going to start spilling over and cause a lot of tearing. But having mucus and lipid helps it to stay on the surface of the eye long enough. The other picture is showing the overall different glands that are making these parts of tear film. So lacrimal gland that is hidden under your top eyelid is in charge of producing the watery part of the tear film. Meibomian glands that are located in your eyelids and they open up right behind the lash line or so-called water line. They are in charge of producing the oily part of the tear film to keep the tear film nice and stable. And conjunctival or clear layer of the eye that covers the white part of the eye is the area where it does have special cells to produce that mucus layer of the tear film or mucin of the tear film. And then a smooth and healthy tear film is essential, as I said, because the optical clarity and focusing ability is based on having a tear film. Tear film is the first part that the light hits before cornea, before our lens, before our retina or optic nerve. So health of that very first layer before the window of the eye is very important to see things very clearly. Even minor disruptions to the tear film can significantly affect your visual quality. When the ocular surface is compromised, light entering the eye scatters and you can see starburst effect, glare, light sensitivity can happen, and clear vision is kind of like not really there once this is not in the best health possible. Another reason behind why is it important to really treat ocular surface disease prior to cataract surgery is that in order to really calculate the lens implant that we're going to replace your cataract with, we really need to have a nice and smooth and healthy surface of the eye. Precise measurements are crucial to optimize your visual outcome after cataract surgery. And these preoperative measurements, they are, really important to determine the exact power of your new intraocular lens. These calculations are very important for optimal post-surgical vision. Dry eyes creates data errors as well. Why? Because once the tear film is not stable or you're not having enough of tear film covering your cornea, it can cause irregular surface. Therefore, inflammation can happen or they can, images can be distorted. And this all can lead to wrong measurements of the intraocular lens implantation, leading to having postoperative residual nearsightedness, farsightedness, or even astigmatism or irregularities that would end up giving you more glare or starburst effect as well. Treatment improves accuracy. So we would like to definitely diagnose what's existing, treat that properly so we can get best measurements possible prior to proceeding with cataract surgery to optimize visual outcome. Other reason that we need to really treat the ocular surface disease is because cataract surgery itself can temporarily worsen dry eyes. The reason is that during the surgery, we make a very small incision to get into the eye, and that disrupts the delicate tear film balance and sometimes the nerves on the surface of the eye. That is enough to cause you some discomfort and dryness after surgery. Medications can cause irritation, so you're going to be on some pre-op and post-op drops, and those especially with the preservatives, can affect the surface of the eye and can cause irritation. And they can even worsen the pre-existing dryness. So we really want to address those issues beforehand so the eye is prepared for cataract surgery. The stress of the cataract surgery, the light exposure through the scope that we operate with, irrigation fluids that we use during the surgery, and the temporary dryness during the surgical procedure because the eye is open in that few minutes that we do the surgery, they can all aggravate existing symptoms. And also, not treating it, it's gonna prolong the recovery process. And sometimes the irritating symptoms can exist for months after surgery. The other reason that we really need to treat the ocular surface disease is to prevent infections. If we have blepharitis, which is actually shown in this picture, you can see like thick eyelids and also some crustiness around the lashes. This is really a condition that needs to be treated prior to cataract surgery. It can take some time. They don't go away all of a sudden because it takes months to years for the condition to get to this stage, and it's going to take some time for it to be managed and controlled before we move on. Moving on with this amount of blepharitis or this condition in the eye can put patients at high risk of having infections following surgery, and those infections could be very vision threatening after surgery. So we have to be really proactively treating this condition and other ocular surface diseases. Now, let's get to a point that, okay, so knowing why is it important to evaluate you properly and in detail prior to surgery to provide you with best visual outcome after cataract surgery, how long and what steps need to be taken and how we can do those evaluations and what are the treatments that we can provide to improve visual outcome after cataract surgery. So diagnosis is very important, and sometimes it's not very easy to diagnose these conditions clearly because they could be very like not as mild, not as severe. It could be mild or just subacute with not showing enough of symptoms. So we had special questionnaires to ask you about what you've been experiencing throughout months or years, what you've been using, as far as dry eye goes, and other, drops or, warm compresses or lid hygiene, and if any of those you've used in the past or any drops that you used in the past, including also your symptoms. Um, then after that, obviously the comprehensive evaluation of your eyelids, tear film quality, and overall health of the eye is going to be done on your cataract evaluation day. And we have advanced diagnostic testings to check for inflammation, which we have tear osmolarity testing. We have MMP9, which is just a tear test to show how much inflammation, if any inflammation, is existing in your eye. And also we have meibomian gland imaging to identify how bad the meibomian glands or the oily glands are involved. And based on which part of these are affected as far as inflammation goes, or malfunctioning glands go, or inflammation of the eyelids and blepharitis go, we kind of like start a treatment for you. Treatment options before cataract surgery include, apart from very basic that I always tell my patients, as soon as I see some malfunctioning glands, even if it is very subtle, even if they don't have any symptoms and they have not been having any, trouble with them, I always say, once I see that there's some gland dysfunction, I say, okay, let's start with the eyelid hygiene with OcuSoft lid scrubs or any sort of lid scrubs that are out there. They're sterile, they're pre-made. There's some sprays, foams, and all sort of like wash for eyelids to get that condition under control. A lot of times you might have heard of baby shampoo, but in more advanced cases, baby shampoo is not enough. So those eye wipes or sprays or foams are much more effective. So I always start with very baseline things such as eye wash followed by warm compress. Warm compress is going to stimulate the gland circulation and let the oily glands to be able to release their secretions into the tear film. And then we're going to go ahead to see whether patients need any sort of lubricating drops. But I look at lubricating drops as just a symptomatic relief. It's just like you are having pain and we give you a pain medication. That is okay for just temporary relief, but it's not okay if we do not look at what's causing the pain. And that's the same thing. So at this place, we want to really make sure what's causing that ocular surface health to be disrupted and address that accordingly. Therefore, apart from washworm compress and lubricating drops that we can use, we look into testing you for any inflammatory reasons. If there is any inflammatory cause behind your dry eyes, we're just going to start short course of anti-inflammatory drops such as steroids, very mild steroids, to calm down the inflammation and technically kickstart the treatment. There are other things that we can do. Sometimes we do a few things at the same time to get that treatment process going faster and get you ready faster for the required cataract surgery or for upcoming cataract surgery. Ponto plugs are tiny devices that we insert into the tear duct to retain your own tear film longer on the surface of the eye. They're really good. They're very kind of like easy to apply. There's no pain, there's no downtime with them. They're dissolvable and or there are the permanent ones. The permanent ones, they don't mean that they're not gonna be able to be reversed, but they're silicone, they don't dissolve, and then we can remove them anytime we want. We have collagen versions that they dissolve after a few months and we can replace them. But again, by themselves or just by doing ponto plugs, we're not going to achieve what exactly we need to achieve prior to cataract surgery. So they're kind of like an adjunctive treatment. We have amniotic membrane treatments that they have been really amazing in this era. Having them really available is a true, I call it magic, honestly, because it just have been showing us and giving us a lot of improvement in a short amount of time, especially when we prepare patients for surgery. All these treatments that I'm actually reviewing with you is just not to get them going for only patients who need cataract surgery. It's just overall treatment process and steps that we put patients who have ocular surface disease or dry eye disease. But definitely, when we want to achieve something faster and get patients ready for some surgery that they need to go with, not just cataract surgery, but eyelid surgeries or another type, I mean, even retina surgeries, it's always good to have these things available and provide these to patients. And amniotic membrane products have been really revolutionary in what we want to achieve as far as the timeline goes. And we have serum drops that we can technically get your own blood and separate the yellow part of it or the plasma and make it into drops. And those are also very great as far as providing the surface of the eye with what really the eye needs, but they take time to really improve the overall health of the eye. So technically, we put them as kind of like the later steps of the treatment. So overall, treatment of ocular surface disease involve multiple steps. So understanding the journey of this treatment, having a realistic expectation sometimes is very hard and frustrating because I have patients who come to me and say, oh, they've been having dry eyes forever. This is what they have to deal with, and they know this is not going to go away. And absolutely, that's not true. We can help, but understanding the fact that this can take some time, because dry eyes, to get to a fact that it's going to involve the whole surface of the eye and give you symptoms is not going to happen in a day or two, a week or two. Several months or years is needed to get the dry eyes to a very symptomatic phase. And therefore, it's going to take some time to improve those conditions. So realistic expectation is very important. Knowing that, okay, there are available options for you, and things can get better, but you just need to give yourself time and be patient is really critical in terms of knowing what you're going to go through. And I think that helps you from getting very frustrated and feeling like, okay, oh, I tried this and this didn't work, and I tried this didn't work. And that's why every step is very important. The treatment is not one and done. It's multiple things that we can provide patients based on what exactly is causing their condition. And not every patient with dry eye has the same kind of like etiology or the cause behind the dryness. So, your path to healthy eyes before cataract surgery involves carefully coordinated therapies that we have to optimize your ocular surface health and to ensure the best possible surgical outcome. Want to really make sure that patients proceed with cataract surgery when they feel really confident and comfortable. This comprehensive approach addresses inflammation, tear production, ocular surface healing to create the optimal foundation for you. And each treatment modality works synergistically to restore and maintain your eye health. I kind of like reviewed this a few slides ago, but I just wanted to show you what we start with. Obviously, I mean, I didn't kind of like put lid scrubs and warm compresses here, as I'm sure everyone knows about that. But, the first and foremost that everyone starts, even on their own, is artificial tears. We do have really good artificial tears these days out there, but I personally would prefer, especially with kind of like mild to moderate cases of, moderate to severe cases of dry eyes, we don't go with drops that they have preservatives because preservatives can irritate your eyes. So technically starting with drops that are preservative free, very good. So there are different brands, different options out there. Ivizia is a very good one. Refresh is good. Sustain is good. TheraTears. Really not much of a difference between these. Refresh Omega and Ivizia, they have a little bit longer lasting effect, but TheraTears are also well. Whichever works for you, that's great. Really not a huge difference between these eye drops. Putting them in the fridge and make them cold and apply, it's going to be very soothing and it's going to calm down the inflammation as well. And then prescription drops, as we spoke, we have different category of drops. From steroids, which we do use them for a little while, but not long term. It's just for a kickstart of a treatment. Then we can go to cyclosporins that we have different category of those. At this time, we have Restasis, which is the very older version of that. Xiidra is the one that came a little bit afterwards, and Viva is it's the most new and recent version of that as far as FDA approved, medications go. This has been, out for about a couple of years now, and it comes in a bottle rather than individuals. It's preservative free still, and as opposed to Xiidra and Restasis, has a lot more of a comfortable feeling because Restasis and Xiidra could be kind of like not very tolerated well by general population because they cause a little burning sensation, blurriness. Viva is mostly much more tolerable. It's barely kind of like felt when it's in the eye. It's more velvety, it spreads and it stays on the surface, sort of has kind of a little bit of an oily base as well. Any of these category of drops will take some time to kick in and to work. Restasis is the one that if we started, it's going to at least take 4 to 6 weeks to start helping the surface of the eye. Xiidra, about a month, and Viva is the one that we can see improvement sooner than the other two. Vital tears or serum drops are the ones that I talked to you about, like coming out of your own blood, and usually are left for, the higher stages or most severe cases that we have. And MIBO is, again, generally more newer category of medications that is being used in patients having meibomian gland dysfunction or oily gland dysfunction, and gives you that oil that patients with meibomian gland dysfunction are lacking. Punctal plugs, again, we briefly reviewed that. Again, we have a collagen version. This one is a collagen version, technically, that it's being placed in the punctum. So we have two tear draining, ducts over here that they connect to each other with, and they go into the sac and to our nose. Sometimes when we cry, we have a runny nose, and that's because our extra tear film goes through our tear ducts and drains through them. So we technically want to block, sometimes with severe dry eye disease, we block both of them. But in this case, it's showing that just like the lower one is plugged. Technically, it's putting a lid over the tear draining, duct to maintain and retain your own tear film on the surface of the eye longer. The collagen version is mostly tolerable in autoimmune cases, patients with autoimmune problems, allergy reactions, or allergic conjunctivitis. I personally tend to refrain from silicone versions because silicone is known to give patients a little bit more of a reaction rather than collagen that is more known to body. That's just my preference. But both of them, they work really well. Silicone version is going to stay if it doesn't fall out, which tends to fall out more commonly compared to collagen version. But it doesn't dissolve, and whenever we want, we can take it out. The procedure is very quick and painless. You're not going to even feel it. It's seconds to put it in. And they're reversible solutions. They're not something that we do and we cannot reverse. We can always, do something about it if it's not tolerated by patients, and we can remove them. And most of the patients actually feel immediate relief after having them placed because they have, generally speaking, a better tear film after having not all of the tear film or most of the tear film being drained to the tear duct. Now to amniotic membranes, which is, really nature's healing power. Amniotic membranes are coming from placenta. And it's processed at bank, and then making sure that every sort of infections or any potential, inflammatory causes are not existing. They're prepared in different versions, and they're known to really give all the anti-inflammatory, anti-scarring, even antimicrobial effects to the tissues. And it's not only used in the eyes, it's actually being used in a lot of other issues, such as patients with having, systemic, and very resistant or reluctant ulcers, or like those who have like problems with diabetes and not healing ulcers and any part of the body. This has been shown to be very effective. Now back to the eyes, we have different versions of amniotic membranes based on how they're processed. We have from powder versions that we mix it with saline, and we put it in a bandage contact lens and we put it on the eye, which is the Neox Flow. And we have another version that is cryopreserved. It's not very thick, but there is a little thin tissue. This CAM 360, and we put it on the surface and we let it be for about at least 24 hours. And we have Procera, which I'm going to show the pictures in next slide. So there are revolutionary healing treatments that we have available. They have a natural healing properties, and they have biological factors like anti-inflammatory cytokines and regenerative proteins. I sometimes call them like vitamin boost to the eyes. And also they help with a nerve function of the surface of the eye, because we could be having some neurotrophic or nerve dysfunction, like what we have as peripheral neuropathy in our body. We could be having like neuropathy in the eyes as well. And that's where amniotic membranes come very handy and very helpful. And, no matter which type of them. They provide very rapid relief and recovery from all the dry spots or ocular surface health, and they've been really amazing as far as treatment of the surface of the eye goes prior to proceeding with any surgical intervention. So, as I talk to you about different versions of amniotic membranes that we have available, CAM 360 is kind of like a little tissue that we prepare from the box that they are provided to us, and we put it in the contact lens, and this is placed on the eye. The procedure is not painful at all. After the procedure is done, you're not going to be expecting any pain. I usually patch the eye with CAM 360 with collagen shield, which dissolves into the eye itself, and you don't even need to have the contact lens removed once it's collagen shield. Neox Flow is the powder version, comes in a little bottle with powders in it, which we mix it with fluid, and we place it in contact lens and put it on the eye. I usually keep it about 2 to 5 days for the eye to have enough time to get all the benefits. Procura is a thicker version. It's not as comfortable as the other two because it comes in a very thick layer with a very slim ring. Technically, this is the very first version of that. The rim was very thick at the time. We still have it, and it's been used in some certain cases. The slim is the most commonly used version of that, which has a, kind of like a little plastic rim that holds the Procura on the surface. These used to be provided to us as like fresh amniotic membranes, and we had to suture them. It was like a lot more intense and invasive and not as comfortable for patients at all. Now it's really amazing to have these available. Not painful at all, so we put it in the eye, but it could give like patients a foreign body sensation, and just movement of the eye could be very disturbing, to patients. And once they're back again for Procura, I use it in patients with much more severe type of like ocular surface disease. It can be actually used for those who have viruses in their eyes, such as HSV or herpes simplex virus, and cornea ulcers. It's been really amazing to have it, and it's very, very helpful in speeding up the recovery from those conditions. And Procura Plus has more thicker layers, and again, that's been used for those people who have more neurotrophic and more cornea, advanced cornea disease. One of the examples that I can show you here before and after using amniotic membrane is that uh, this is not uncommon to see in a lot of our patients. We see a lot of patients that this is technically a picture of the eye. This is cornea. We use like a little yellow drop to check pressures, but that is not just for pressures. It actually shows us a lot of things on the surface of the eye to evaluate further how much dryness we have on the surface, how much irregularity of the surface we're, have to deal with. And all of these spots that you see here, they're all dry spots. So patients with this sort of a, clinical picture, they definitely have symptoms of like sandpaper-like or foreign body sensation, light sensitivity, fluctuation of vision. And let's say if this is a patient who needs to have cataract surgery, definitely should not be put through cataract surgery until this is, technically taken care of. Because as you see, if you want to go ahead and put this patient into the, measurement of the intraocular lens implant machines, this is not going to really show us a very accurate reading because the surface is really not as smooth. So that's one of the times that we see these kind of like patients that we have to start really treatment from, not just with only lubricating drops, but also with anti-inflammatory drops, and at the same time doing further, including amniotic membrane products to be used in these cases to speed up the treatment process and get them ready for any upcoming surgery so we can optimize visual outcomes. So this patient is actually one of my own patients, had this much of dryness on the eye, and the other eye also had a lot of that going pretty diffuse. And then after Neox flow, which is just a powder of a fluid and contact lens on the surface of the eye being removed a week after surgery, I mean, after the amniotic membrane was placed, you can see all of those dry spots are gone. And you cannot see any sort of more pulling of the, color drop into that area. This is much more smoother than what you can see here. So you can even not see anything through the pupil, and then over here, things are much more visible. So just to summarize why screening and treatment matters prior to cataract surgery is that accurate measurements are the key to provide you with optimal visual outcome that you're really hoping for to achieve after cataract surgery. All the testings and pre-op measurements rely on how healthy the surface of the eye is. So we should get accurate measurements while once the surface of the eye is healed better. Foundation for success is a healthy tear film that creates the essential foundation for achieving the best possible surgical outcome and your satisfaction. The technologies that we have available are better than ever. We have cutting edge techniques and a lot of different high technology premium lens implants that they provide you exceptional results. However, it's very, very important to make sure that you can get the best out of them and the best vision correction once the surface is really nice and clear. Otherwise, patients who have ocular surface disease and they get the premium lenses, they might be in a lot of trouble due to glare or halos. So that's one of the things that we really want to achieve for them so they can benefit from the high technology lens implants that we have available. And of course, our goal is to maximize satisfaction. So nothing is more important than making patients happy and providing them with not only the best vision potential, but the most healthy eye they could have. So treatment of ocular surface disease will continue after cataract surgery because, as I mentioned, dry eye disease, blepharitis, meibomian gland dysfunction, inflammatory causes, autoimmune causes, like those patients who have Sjogren disease, those patients who have cancers and have gone through bone marrow transplantation and they have graft versus host disease, all of them will be having some chronic condition that is not just for cataract surgery, but also after cataract surgery to have them under the best treatment possible to not only treat the condition, but also maintain the health of the eye. So that is it. And I'm happy to answer any questions if there are any. Any questions that I can answer?
Doesn't look like there's any questions, but maybe we'll just wait a minute or so.
Yeah,
See if any trickle in.
yeah.
Okay. We have one. Oh, someone said thank you. Very informative.
Of course, of course, of course.
We actually just got one. Actually, it says, will you tell us if we would be better off waiting for cataract surgery if we have any degree of IOC?
Um, so as I said, it's very, very important to talk to your surgeon and have them explain to you where you're at as far as the stage of any of the ocular surface health, conditions that you might be having. Um, and I got that other question. I'm going to answer that question in a second. Um, again, a lot of patients come in and then they have mild to moderate dry eyes. We can get them, going in a few weeks. But sometimes, given the severity of the condition, that's what matters the most, to make sure we figure out and we, do all the testings that are required, explain to you what exactly you have and what treatments you need to go, and then determine the time that you need to be going to have the cataract surgery done. Like I had a patient today that she came to me. She was referred by another colleague of mine who scheduled a patient for next week to have surgery done. But she was seen a couple of days ago for, final evaluation, and surgery was canceled for her because the surface of the eye was not ready. So when I saw her today and I did some testings, I said, she had a moderate to severe. So I said, well, maybe not for another couple months. But sometimes they have like milder versions and we can get them ready faster. So it's all depends on what every patient has and what sort of conditions we need to address. But definitely the different and recent medications and amniotic membranes that we have available can get patients ready for cataract surgery much faster than before. Um, I hope that answered their question. How does Fuchs affect cataract surgery? I got that question. That's really great. That's another thing that I will definitely talk about that in the future, near future about that. Fuchs dystrophy is a cornea condition. I'm just, going to explain that for, a whole audience. That the inner cells of our cornea technically is in charge of pumping out fluid from cornea, so our cornea can stay clear from retaining any fluid and becoming cloudy. So depending on what stage of Fuchs we have, Fuchs affects those endothelial cells. So they don't really work well, or we kind of like lose some of those endothelial cells and we're prone to have corneal edema after cataract surgery or corneal swelling after cataract surgery. So again, depending on the stage, I'm a cornea specialist, so for every case of mine that I evaluate for cataract, I do endothelial cell testing and see where they're at, in addition to their clinical exam findings. If I see a moderate to severe Fuchs dystrophy, I might consider a combination of cataract and transplant surgery, which we just go ahead and transplant that layer only. We do not need to do complete transplantation of the cornea. Sometimes it's just no, we can straight go to cataract surgery with special attention. I plan it a little bit differently. The surgical skills is a little bit different and surgical steps are a little different to preserve those endothelial cells that are not as strong as general population that they don't have Fuchs dystrophy. And obviously in Fuchs patients, there's a little bit higher chance of cornea decompensation, cornea swelling, longer healing process, and potential need for cornea surgery if cornea swelling doesn't go down with post-op eye drops.
Okay. And then the next one is there a laser treatment for dry eye? Somebody asked.
That's a very good question too. So we do have different procedures for dry eye disease. Again, depending on what is causing the dry eye disease. If we have meibomian gland dysfunction causing dry eye disease or as the main cause of dry eye disease, we do meibography, which is an image of meibomian glands to see how much drop or loss of meibomian glands we see, which stage of meibomian gland disease is at. And then we have LipiFlow, which is not a laser, it's a machine that technically using warmth and pressure, it's going to help them release their secretions. And then we have laser, which is IPL for meibomian gland dysfunction that helps the circulation of the glands as well. We do have that at Harvard Eye as well. So patients go through, steps as far as evaluation goes. And then, yes, definitely IPL can be very helpful. Usually last pretty long, longer than LipiFlow, but every 6 months, patients need a little bit touch up to keep and maintain the results. I hope that answers their question.
Thank you, Dr. Rouhani. And then the next one says, does a patient get tested by the machines for dry eye disease before they see an ophthalmologist? They said they have dry eyes and use Refresh and do not feel the dry eye disease.
A lot of optometrists, when they evaluate their patients, they evaluate them as far as the dry eye goes. There are some that they don't, so they say, okay, just use artificial tears, use wash and warm compresses, but we definitely listen to, again, with those questionnaires and also clinical evaluations, then we put them through testings to make sure, as surgeons even, like during patients' cataract evaluation visit, we kind of like get those things done for them to, just make sure that we're not overseeing or, not noticing what's going on, even patients are asymptomatic and not having really symptoms. So I think the best thing here is because a lot of patients, they have optometrists and they're being sent or referred to us for surgery by their optometrist, and they might have been told that they have dry eyes, but they likely didn't have a complete evaluation for dry eyes. Once they mention it to their surgeons, they will definitely put them through the process and the steps of getting those tests done and making sure they're going to be prepared for surgery and they're going to be expecting, hopefully, really optimized visual outcome.
Okay. Thank you, Dr. Rouhani. And then is that the same for glaucoma? Like if somebody has glaucoma, how does that
Of
affect cataract
course.
surgery as well?
Well, of course. So, just to briefly explain about cataract surgery evaluation. So, um, at Harvard Eye, what we do is that, let's say I see a patient on my list for cataract evaluation. That doesn't necessarily only mean that I'm going to look at the cataract and say, oh, okay, so cataract is existing, let's go ahead and do surgery. It's going to be a complete examination. Sometimes takes a while for a patient to be here because they're going to go through different steps of evaluation from not only vision and eye pressure, but also different testing, different imaging, and dilating eye examination. Why? Because as I mentioned early to this presentation, we not only look at cataract and the stage of the cataract and the necessity for cataract surgery, but we look at the surface of the eye, the tear film, the glands, then the cornea health, such as like conditions such as Fuchs dystrophy or other genetic conditions can affect the optimal visual outcome. It's not just dry eye disease, but this was more focused on something that is very common, more than Fuchs dystrophy, more than EBMD or other cornea conditions. But also I look at all the surgeons, not just myself, but regardless of what subspecialty we have, like myself as a cornea specialist, general ophthalmologists, glaucoma specialists who are cataract surgeons, they look at every part of the eye. And let's say if I see any retinal pathology or if I suspect glaucoma, then I'm going to put them through glaucoma testings, and then we're going to move on with cataract surgery. Why? Because retinal pathology, glaucoma, cornea pathology, ocular surface disease, they all determine what type of a lens implant we're going to move on with cataract surgery. Not every lens implant is great for every case. So based on whether they're having glaucoma, retina issue, cornea issue, or just having a healthy eye, we go ahead and provide patients with the lens implants options that they have available. But yes, they're definitely going to go through a whole complete eye examination, including glaucoma testing.
Okay. Thank you, Dr. Rouhani. And then I'm not sure if you're able to answer this one, but somebody asked if Medicare coverage or does Medicare cover amniotic membranes treatment?
Yes,
Okay.
most of the insurances they do. Medicare definitely does. Yes, we have to provide enough information for patients, but Medicare is one of the ones that accepts all different kinds of amniotic membranes. Yes. Or other insurances, some of the other insurances, we have to get the authorization. But Medicare patients are the ones that technically at the time of visit, if they really need it, we don't need to wait for authorization.
Great. Thank you so much. Yeah, and I think that was the last question, Dr. Rouhani. So I appreciate it.
Of course, of course. Anything else, I'm happy to answer.
Okay. I think that should be. Oh, wait. Actually, we had one come in. Oh, someone said thank you. So.
Of course.
We
Of
appreciate it. Yeah, we're happy
course.
everybody enjoyed the presentation. So, thank you so much for attending, everyone, and thank you so much for the presentation, Dr. Rouhani. All of our guests, we greatly appreciate it. Once again, if you do have any additional questions, please feel free to email us if any come up at a later time at marketing@harvardeye.com, and we'll be sure to respond to those. Also, the presentation will be available on our YouTube channel if you'd like to rewatch it at a later time or share it with any friends and family. Other than that, we hope to see you at our next webinar event and have a great evening. Happy holidays, everyone.
Have a good evening. Thank you, Gabriel. Thank you. Have a good night, everyone.
Thank you. Bye bye.